in India, so that's the reason I thought to change K1, right? K1, right? Kidney 1. So K1 energy starts from the sole of the foot. From the sole of the foot, bilaterally the energy is symmetrical. From here it ascends to the upward direction on the navicular bone. From the navicular bone it goes to the medial malleolus and then communicates to the Achilles tendon. From the Achilles tendon it encircles here, and then further it moves to the superior to the ankle region. From the ankle region it goes to the inside of the knee region. From the inside of the knee region it goes to the pelvic region. From the pelvic region it goes to the navel. From the navel it ascends to the chest region. From the chest region it communicates on the clavicle. This is the superficial energy pathways, right? The entire energy, the totally 27 acupuncture points are existing. If you understand 12 acupuncture points out of it, then it is equivalent to the 27 acupuncture points. Now let me start one by one. The K1 acupuncture point. Just I clean this area because this is the dirtiest area, especially, right? So we clean the entire area of the sole of the foot. But then we insert the needle here, especially on the K1 region, right? This is called as a kidney 1 acupuncture point. But now where exactly precisely this point is located, let me see. There are the 3 arches there for the sole of the foot region. One is the medial longitudinal arch, lateral and then transverse arch is there. This arch to be known as a transverse arch. This arch to be known as a transverse arch. This is lateral longitudinal arch. This is the medial longitudinal arch. Right, there are the 3 arch. But now how to understand this exactly this point? So first one is the transverse arch. Transverse arch means that is as a web margin of the sole of the toes. So this is the web margin. How this is called as a web margin of the fingers, but this is not accountable here. Fingers or the toes are not accountable. You just look at about this arch and then the heel region. From here to here divide into 3 parts. One is the upper part, middle part, lower part. So this particular point is located 1/3 of the upper portion of the transverse arch of the foot, midway between the second and third metatarsal phalangeal joints. Second and third. Now this is the second and then third. Midway between these two, this point is located. So this point among the traditional Chinese acupuncture, out of maximum 400 points, only one acupuncture point is existing on the sole of the foot region. No other points are existing. When we look at about the reflexology, reflexology is not totally proven subject, but still the practitioners are practicing from the centuries. The entire area, this also internal organs are located here. This area totally as a spine towards the top of the head region. According to the traditional Chinese medicine says that the top diseases treatable down, vice versa. Now this is the sole of the foot. You are treating for the sole to treat for the kidney problem and also treating for the brain as well. Now what are the indications it is recommended? Because this particular point is known as a first point of the kidney, but according to the Dr. Wolz, this point is not kidney, but the point of the kidney 1 is this point. Show me, give me one more needle. I will show you which is the K1 point. This is as per the TCM. As per the allopathy acupuncture, or as per the modern acupuncture, K1 point is located. This is the K1 point. K1 point is, do you know where is the Chai Yin point? UB67 point. Point 1 tune proximal to the lateral corner of the nail base of the pinky toe is the first point of the last point of the UB67. Same on the anterior position on the medial side, K1 point. I apply this to both. In some conditions, especially for the renal impairment, I apply 2 points. One is the K1, I apply this point, and also I apply the K1 this point. Because do you know, according to the theoretical aspect, when we understand about the pinky finger, think about this. So this is the Shaoshang. Point is completing on the H9 on the medial side, that means inside of the pinky finger. Shauza, that is SI1, is starting from the lateral position of this particular LISI1. Now SI1, H9 completed here, SI1 started here, right? UB67 completed here, but K1 is starting here. You understand? UB67 completed here on pinky toe. Now the K1 is starting here, but H9 completed on inside, but SI1 started here. Both are coupled organ. That is, small intestine, heart is yin and yang organs. Whereas in similar way, kidney meridian, UB67 is the Fu viscera. Fu viscera is communicating to the in viscera with the other side of the same toe. K1 is sole of the foot, that has been proven. But according to my perception and also with the modern medicine concept, but the energy starts from the other part of the pinky toe. So therefore, for the 2 acupuncture points location, point 1 tune proximal to the medial side of the corner of the nail base of the pinky toe. If somebody write the location of that particular point, also right answer. When the person write 1/3 anterior to the center of the sole of the foot, midway between the second and third toe in the depression, that also right answer. Right, both the answers are correct. Now this particular point is treatable because this is the beginning point of the water element to be known as a kidney 1, also belongs to the wood point. Do you know all the in viscera starting points of the 5 elements points from the wood? So this is the wood point. The K1 is communicating to the wood, that means is the liver. The kidney and then liver is communicating point. Once you apply the K1, that point is communicating to supporting to the liver. So that means K1 is the sun point and the liver 8 is the mother point. You are treating to the sun and then mother collectively by activating the one particular point, that's known as a Yung Chuan and then Chu Chuan. K1 and then liver 8 is the equal proportion. You wanted to treat for the K1 is not possible, then you treat for by using the Chu Chuan liver 8 also recommended. But by the way, rather than liver 8, I strongly believe that the K1 is most powerful point, since it is normally day-to-day clinical practice. It is not much recommended for the small problems, but generally because it is a very painful point, when the patient comes to you in the first time, you are just inserting the needle is the K1, the next time he will get the bitter experience to come back to further management. So therefore it is not recommended. Better in the beginning stage apply the very less painful points. But even yesterday I applied, you can't believe it, that is a 1.5-year-old, 1.5-year-old baby. Honestly I am telling you, she never cried. I just applied 5 points to her. She never cried, but she is happily smiling on the bed with her mother. So therefore that is the beauty and art. But one first sitting you are just apply K1, that get very astonishing pain, and really it is horrible. But the condition indication also, it's the major indications. Why it is so powerful? Because of the whole weight is bearing on the sole of the foot. There is the biggest and layer of the fascia is accumulated. The fascia of the aponeurosis of the fascia, which is located on the sole of the foot, that is required to take up the gravity. When we look at about the Qigong exercises or any kind of the exercises, the whole strength to be placed where exactly on the sole, right? The knee, people says on the back and the knee, and of course, but entire spectrum, one person is around 60 kgs or the 120 kgs or 220 kgs, but he is walking, then you understand his the whole weight is bears on the sole of the foot. So therefore that particular muscles are very strong layer of the fascia. So that fascia, you just inserting that fascia is communicating interiorly to support the liver. When the liver is good, then the liver is supporting the blood to the heart. When the heart is good, that's supporting to the brain. So therefore there is a communication. But the top diseases treatable by using the K1 point, when the person having the amnesia, when the person is shortness of breath or some kind of the coma or shock or fainting or drowning, anything for emergencies. When even I look into that particular point, when I visit sometimes for emergency to the home, that time I will try to apply the needle when the person is alive or not. Once we apply this point, because I told you is the super painful point to be known as a K1. So once apply this particular point, the person is small, survival of the life is there. He will pull the leg immediately. He will change the position of the body. If the dead body is there, he don't change anything. But if the living body is there, we try to apply and then feel the changes in that particular region. Of course, that much powerful point. When the person is in the coma situation where the hospital people are putting for the several months on the bed, make sure you just apply these 4 points I wanted to tell you for the coma conditions. Certainly that will be helpful. One point of course is the Yung Chuan, that is the K1. The second point to be known as a Shaoshang, that is the LU11. The third point to be known as a Shaochung, that is the H9 point, and the fourth point to be known as the Renchung or the Tuichuan, that is Du26. So these are the points. Exactly this is the points are all the yang meridians are opening point. When the yang is not there, when the brightness is not there, at the same time there is the everything is constricted, there is no vasodilatation, but that time it is required the adrenergic effect, it is required the vasoconstrictor effect to push the blood to the upward direction to the scalp in order to open, in order to see, in order to open and then walk and then bring the awareness within him that he is the alive. So in that way we just activate this particular all these points, because H9 regulating to the heart, LU9 is the emergency point for the lungs, and then Du26 is the opening point for the all the yang organs. So collectively we just activate, these are the 4 points that will be really helpful to the patient to open up this, and that will be really amazing. So therefore this is the only the one point, a K1 point, communicating to the paradise, communicating to the heaven, communicating to the earth, to the human. This one point, earth, heaven, and then human, communicating point to be known as a K1, so that there is the most powerful and opening point to the renal system. The kidneys are opening. When there is the emergency point to be recommended, there is a retention of the urine is there, the urine are not passing, so that particular time we wanted to activate. So certainly strongly we just activate this point, the chances are there the retention of urine that flow rapidly, right? Especially on the kidney malfunction, kidney impairment patients, right? When we wanted to flow, the urine is not passing precisely, only the 50 ml in a day or 100 ml in a day or 300 ml in a day is passing. So that particular time we wanted to increase the flow of the water. Certainly we strongly activate this point. At the same time can be given as a moxibustion as well. Be careful when doing the moxibustion. When you touches to this, especially the diabetes patient, it is not recommended the moxibustion on the sole of the foot. Otherwise, without diabetes patient, certainly we can use the moxibustion strongly. Bilaterally activation is required. So you just activate the right side kidney. When right side K1 is the right side kidney is applicable. Left side point, the left side kidney is applicable. Bilaterally you wanted to activate because the kidneys are existing too. Then you wanted to activate bilaterally to the essence and then the gate of vitality and then the original kidney. So together you wanted to activate. Certainly it is recommended. When the person anything connected to the impotency, premature ejaculation or the infertility conditions, male and female related problem, headache related disorders, fatigueness and lethargy, amnesia condition, memory is very poor and always the person is very lethargy, and then the back pain condition, sole of the foot there is no sensation at all, diabetes neuropathic conditions and also numbness conditions, burning sensation on the sole of the foot, all are recommended by activating this point. At the same time when the liver also having the less function, activate this point always is good. Hopefully you understand this is the one particular point always for the day-to-day clinical practice. You wanted to use the micro needle, it is recommended. If you wanted to use half tune also good, 1 tune also good, 1.5 tune. But I wanted to give you complementary to this point to all of you. 1K1 is the very painful point as all of you knows now. Then you wanted to use the another point by using the same effect, then that point to be known as a Tai Chung. Tai Chung, that is the liver 3. Liver 3 you just apply, try to see the K1 point. K1 you just place the finger on the K1 location. You just place the K1 location of the finger. Then once you just place it like this, apply the needle from here and then that touches to the K1, that comes to the nearer to the K1, then you just leave it. This is the half tune is not recommended, 1 tune is not recommended, 1.5 tune needle is recommended to apply and reach the destination, right? Or else you wanted to apply when the person is nothing feeling is there and no sensation is there, that time you just do 2 needles in one particular point. One is the Tai Chung, apply here, then the one needle comes out from here. Then for example I just apply this from here, I just apply the K1 and then I just inserting this to the deeper level and this also coming outside of this. See, the needle has come outside. So in this way we can apply the needle, but make sure when the patient allows you or when the patient is not feeling anything, that time you can apply in this way. Make sure that the diabetic neuropathy, if you shouldn't feel any kind of the infection, make sure to clean the entire area on the dorsal region and also on the ventral region is recommended.